Bowel cancer is an incredibly common form of cancer. It's already common knowledge that cancer affects 1 in 3 people out there, so somebody you know will get cancer at some point in their life, and it may be that they do develop bowel cancer.
I thought that I'd go for this, for the new treatment, and see how that went, and join in, to try and prove which was best for other patients as well as myself.
I'm working here in Leeds at the University Hospital at St James's, and I specialise in the treatment and research of patients with gastrointestinal tract cancer. By that I mean cancer of the stomach and the bowel. Patients with advanced bowel cancer have a pretty difficult time at the moment, and for the people who are going into the Piccolo trial, I think there are 2 important things that we're trying to achieve. The first is to make their treatment more effective, so that's the number 1 priority. But the number 2 priority, which is very close behind it, is to reduce the side effects of treatment. Everybody knows that cancer treatments can be tough, and we're trying to reduce that burden for our patients. One of the big issues for us in treating cancer is that people respond differently to the same treatment. There's one particular gene that we've adopted into this Piccolo trial. It's called KRAS. And what's been found is that if that gene has been altered, then there are certain types of drug which don't work and others that do. And patients who are going into Piccolo are now having their tumours tested for this gene before they start treatment. And that's allowing us to concentrate on those patients who are most likely to benefit from one particular drug. And that drug is called panitumumab. The other question that's being asked in Piccolo is around reducing the side effects of treatment. And so for all the other patients going into the trial who aren't going to be going into the panitumumab treatment, we're able to ask that question. The particular cancer drug that we're using in Piccolo is called irinotecan, and patients will be either receiving irinotecan alone or irinotecan in this new way where it's modified by giving it along with another medicine called cyclosporin, and we're very carefully monitoring the side effects of patients on those 2 treatments to try to establish whether the new form of treatment with cyclosporin can reduce the side effects of chemotherapy whilst keeping the effectiveness.
We need to have clinical trials like this all the time to keep things moving forward.
Cancer Research UK, in the work that it's funding here in the UK, is extremely well placed to advance this field and to make sure that those treatments are, that we make the very most of those treatments. Donations to this project will directly fund our research looking for more effective and less toxic treatments for patients with bowel cancer.